You're watching the Health Talk session by Yashoda Hospitals. Peripheral vascular disease is common yet serious condition affecting millions of people across the globe. It is a well-established fact that peripheral vascular disease is associated with cerebrovascular stroke and cardiovascular disease. In this episode, we'll highlight the recent newer advancements in the treatment of peripheral vascular disease and, more importantly, its preventive methods. I'm Dr. Lakshmi, and joining us today, we have with us Dr. Srikanth Raju, Senior Consultant Vascular Surgeon and Endovascular Surgeon from Yashoda Hospitals, High-Tech City. Welcome to the program, Doctor.
Hi.
So, Doctor, although peripheral artery disease has been historically underappreciated when compared to stroke and heart diseases, greater attention in recent years has led to significant newer outcomes. So, why do you think this condition is so common in our country?
See, peripheral arterial disease is the most common disease which we are facing nowadays in a present scenario. It is as common as coronary artery disease and carotid artery disease. Usually what they say is 30% of the patients with coronary artery disease tend to have peripheral vascular disease or carotid artery disease and vice versa. These three diseases are usually intermingled, and if a patient is affected with one, they might have one or the other disease in future. So most of the general population in this current scenario who are smokers, diabetics, and in those population usually we come across this peripheral arterial disease.
So peripheral vascular disease is not only a disease on its own, but it's an independent predictor of cardiovascular mortality and stroke and death. So how similar is peripheral vascular disease when compared to coronary artery disease, Doctor?
See, actually, if I have to say in a simple language, in a common people's language, for a heart disease, if patients have, they call as a heart attack. In the same way, why that heart attack occurs? It occurs because there is a disease in blood tubes which carry blood towards the heart. If they have a problem in that, we call it as a coronary artery disease. In the similar fashion, in the peripheral parts of our body, for example, lower limbs or upper limbs, or in the carotid artery disease, in those situations which the blood tubes which carry blood from the heart towards the individual organs, if they have disease in those organs, we call it as a peripheral arterial disease. For example, if the same condition occurs in the lower limbs, we call it as a PAD, peripheral arterial disease. In the same way, if it occurs for the arteries which carrying blood towards the intestines, we call it as a mesenteric ischemia. If the same thing happens in the upper limbs, we call it as a peripheral arterial disease in the upper limbs. And if it happens in the blood tubes which carry blood towards the brain, they are carotid arteries. If you have a disease in them, we call it as a carotid artery disease. The disease process and occurrences, it is very much similar to the coronary artery disease. Only thing is the location where it is occurring is different.
So that means that this condition can affect any part or organ of the body. So what are some potential risk factors which are associated with this condition, Doctor?
The potential risk factors associated with this disease is smoking, tobacco chewing, and apart from that, uncontrolled diabetes and sedentary lifestyle, overweight. All these factors and come together in occurrence of this disease.
So understanding this condition, Doctor, what are some typical symptoms that patient usually present with?
See, usually peripheral arterial disease occurs in lower limbs. That is the most common location at which usually it occurs. For the lower limbs, if a patient is having a peripheral arterial disease, the earliest sign to occur is claudication. Claudication is nothing but if a patient walks, after he starts walking after some time, there will be a crampy pain in his calf or in the thigh muscles. This is the most common symptom which occurs in the most of the patients, which hamper them from walking. And if the disease progresses from that situation, it leads to rest pain. Rest pain is nothing but patients will be having a severe pain in their foot and toes in the foot, which leads them not to have a great sleep. They will not be able to sleep at all. So that's why we call it as a rest pain. And the third most common symptom which usually occurs in the peripheral arterial disease is non-healing ulcers in the foot or development of a gangrene. That is the most diagnostic symptom with which most of the patients usually come to us.
So I'm sure even if small symptoms, if left unchecked, can lead to some serious complications. So what are some complications which are associated with peripheral vascular disease, doctor?
The common complications which will be occurring with this condition if they are not addressed at a proper time is the patients might lose toes, forefoot, or sometimes it might lead to the below knee or above knee amputation. So disability is the most common thing usually occurs in most of these patients if this problem is not addressed at a proper time. In the post-operative situation also, if a patient has lost one leg, there is 20 to 30% chances of affecting the other limb in next 2 years. And at the same time, these patients have a higher risk for coronary artery disease and even carotid artery disease. Some patients post-operatively, if they don't take a proper care in saving the limb at a proper time, these patients, when they lose a major limb, they might go into a depression sometimes that might lead to suicidal tendencies in some patients.
So when a patient presents to your clinic with these symptoms, and if we have to rule out peripheral vascular disease, what are some diagnostic tests that we usually run, doctor?
See, the most important symptoms I already told you, like claudication, rest pain, and gangrene or a non-healing ulcer in the foot. But when patient comes to a clinic to us, we physically examine the patient and try to see if there are any palpable pulses in their lower limbs. If those pulses are not palpable, the first immediate thing what we do is ankle brachial index and toe brachial index. According to that, we try to find out if there is a hampered blood flow in their lower limb or not. Once we find that there is a decreased blood supply in the limbs, such patients we go for a CT peripheral angiogram where we try to see the level of occlusion, the length of occlusion, and the severity of the disease. According to that, we suggest them what is required in the future.
So doctor, do you generally see patients presenting to you at a later stage of the disease because they have neglected the symptoms in the beginning? And if so, what challenges do you face and how do you encounter them?
See, usually patients presents to us at a later stage only, because most of the people usually they are not very much knowledgeable about having peripheral arterial disease. In the village background, patients coming from low socio-economic status, they usually neglect their body a lot. In the whole body, limbs are most negligible part in a person's daily life. So when they have an ulcer, when they have a wound in the foot, they usually take only tablets from a medical shop or a quacks, and they try to neglect it to an extent where they might lose a greater part of their foot, or even they come to a situation where when they come to us, even though if we try to revascularize them, they might lose their limb up to a below knee level or above knee level. So we have encountered in many patients in such a bad situation. So we suggest them to come to a vascular surgeon like us at a proper time so that we can save their limb and even life.
So now discussing about the treatment part, what are the latest advancements in this field to treat this condition, doctor?
See, in earlier days, what we have is when patients with these conditions usually used to come to us, we used to go for a traditional open surgical methods. Open surgical methods is nothing like when patient have a wound in the leg or foot. In order to heal that wound, there should be a proper blood supply. In order to establish a proper blood supply, in the earlier days, what we used to do is we used to do a bypass in the lower limbs, like what we do a bypass in the heart. But now with the latest advancement, we are doing angioplasty, stuntings in the lower limbs, so to improve the blood supply. And there are many advances which have come. Even there are intravascular lithotripsy. Like there are many newer things which are coming into this vascular field, where usually the procedure are done under local anesthesia and as a daycare, and even patient can be discharged immediately the very next day. In a traditional open surgeries, patient usually requires anesthesia. Post anesthesia, they have to stay in the hospital for 5 to 6 days, and following the surgery also, they have to get a dressing for their wounds daily, at least for 2 to 3 weeks until the sutures are removed. But now with this modern endovascular techniques, there will be no scars in the legs. There is no need of any bypass. With a simple micro puncture, we will be able to do the procedure. As a daycare, we usually do it as all these procedures.
So that means that these techniques are minimally invasive, resulting in faster recovery and lesser stay in the hospital, doctor?
Actually, these techniques are non-invasive. They are invasive, but with micro punctures we do. Like what they do a coronary angiogram and coronary angioplasty. In the same way, with that same micro punctures, we'll be dealing with the blood tubes in the lower limbs. So in that way, not more than 24 hours duration stay is required in this particular conditions.
So it's now time to bust few myths and know the facts. Taking the first one, peripheral vascular disease affects only older people.
No, peripheral arterial disease not only affects older people, it even can affect younger people who are chronic smokers.
Taking the next one, only people with family history of peripheral vascular disease can get affected.
Peripheral arterial disease, there is no need of any family history, and people who are smokers, they can be subjected to this disease in spite of not having a family history.
Peripheral vascular disease is not life-threatening condition.
Peripheral arterial disease is normally it's not a life-threatening, but if the secondary infections occur, in such situation, it might lead to limb loss and life loss.
Taking the next one, peripheral vascular disease affects majorly males and females are less affected.
No, peripheral arterial disease can occur both in males and females.
Only people who are obese or overweight can get peripheral vascular disease.
No, patients who are thin built also can occur with peripheral arterial disease.
So doctor, as we know that most of the diseases are a consequence of lifestyle habits, are there any lifestyle modifications that we can take up to prevent this condition, doctor?
Usually patients with peripheral arterial disease, they have to quit smoking and they should even quit tobacco chewing. And apart from that, 20% of diabetic patients tend to have peripheral arterial disease. So what are the precautions we take in a diabetic patients, we should follow even in peripheral arterial disease, such as they have to go for a regular exercise, they have to quit carbohydrate diet, and apart from that, they have to maintain a strict diabetic control. These factors usually help them to win over peripheral arterial disease.
So before ending this episode, doctor, what message you would like to give to our audience out there as far as peripheral vascular disease is concerned?
See, peripheral arterial disease, it's becoming in rapid and it is spreading a lot in most of the patients. And right now, there are better health facilities which are available in a hospitals like our Yashoda hospital. If you come across any such problems, please contact at the earliest point so that with a minimal procedures or minimal treatment, we can save their limbs and life. See, in most of our Indian patients, the male or the main person in the family is a single blood earner. If we were able to save such a person's limb, we not only save a patient's life, we save whole family. So save a limb, save a life, save a family.
So thank you, doctor. It was wonderful having you here on the program today.
Thank you.
So this brings us to the end of this episode. Hope this episode was informative on the topic peripheral vascular disease and its recent advancements in the treatment. And don't forget to join us for the next week as well. Until then, take care and stay healthy. Thank you.